I treat people with headache disorders primarily. So a good chunk of my clinic is migraines, but also I treat less common headache disorders and also certain facial pain conditions. I tell all my patients that, for almost all of them, for the vast majority, headaches are not a life-threatening condition so much as they are a life-ruining one. They really impact their quality of life, and they prevent people from going to work. When I see a patient, I always try to, besides getting the history of their actual headache, I try to get the history of them. I get information about them. I ask everybody what they do for a living. I like to ask about a little bit about their hobbies and the things that they like to do when they're not at work. And what I really try to get at is not just about their headaches, but also how the headaches impact their life and what we can do to try to improve that quality of life by making a really unique and tailored treatment plan towards them. The other thing I tell everybody is headaches are very much not a one-size-fits-all. And something that just works really well for one individual is terrible for another and vice versa. And so I really just make a point of saying, look, it's about you. You're the boss, I'm the guide. And I just try to guide them as best as I can towards an effective treatment plan to improve their quality of life. I would say there's two things that I really love about my job. The first is that I go to work each day not knowing what to expect. Every patient is unique, People always say, well, no, they all have headaches. They do, but every headache is unique, and every patient's story is unique, and how it affects them all is unique. And so not knowing what I'm going to get every day is really rewarding. I think pretty much every single patient, we can improve their quality of life to some degree. Whether and that's not always, a cure and getting rid of their headaches completely, but we can improve it by 10%, by 30%, by 50%. That offers them more days of headache freedom, more days of, good quality of life, more time with their family, more time doing the things they want to do, and without the burden of these conditions. And so I think the ability to help so many people is just really tremendously rewarding.